Maybe I have to give an analogy. Let's say in the bush, what are you afraid of? Snakes, spiders, lions. People like lions. They're not lions. They're roaming freely in Zimbabwe. But snakes, certainly people are so much afraid of snakes. So what happens when you're afraid of your snake? And then, so what happens when you see a snake? You're going to run. What is called the fight and flight. So you're going to run or you're going to fight it. If it's a lion, then obviously you're carrying a gun, you're going to kill it. If it's a snake, the usual reaction is always to beat it. You get a stone or get a stick to beat the snake. So you fight it or you freeze. Play dead, you just freeze and collapse. So for that to happen, the body produces a chemical called adrenaline and lots of other chemicals. But let's just talk about adrenaline. So when there's lots of adrenaline in your body, it's going to go into your heart and make your heart to beat fast, so that you can take the blood around your body so that you can run or whatever you want to do. There's lots of blood going to the legs and the arms as well so that you can fight or you can run. And then also there's no blood in the head, and then all the blood is going to the head, the legs and arms. So you're going to feel lightheaded. I don't know if you've run 100 meters. How do you feel when you run 100 meters? You feel lightheaded. And when you get to the finishing line, what happens? You collapse. And when you collapse, what do people do? They bring a watch or something fancy to make you remove your clothes and stuff like that. It shouldn't be like that, actually. The reason why you collapse is to make sure the blood goes back to the head. So if you actually lift their legs and then let the blood go back to the head. But people don't do that anyway. So that's lightheadedness. And at night, if you're an African like me, you're obviously going to think someone sent the snake. Someone may set up the lion for you, and then that's why you can't sleep now, you're worrying about whatever happens. And then all those things happen. So that's just an analogy. That's the same thing which happens with anxiety and stress. When you are under stress, usually it can be positive or negative. Positive is when the good things are going to happen to you. Like what happens when you win the lotto, what do you do? Scream and be happy. That's not true. Obviously, you worry. How am I going to spend this money? $100,000 suddenly in your pocket. You start worrying, but you spend half the time worrying, how am I going to spend this money? When you really figure out how you're going to spend the money, half of it is gone. Then you are really going to start having proper worry now. So that's what happens. And then the same chemical adrenaline gets produced. Now you can look at it now. If there's lots of blood going to the heart, and there's no lion, there's no snake, and the heart is start going to beat fast. That's why you have the palpitations. So if the palpitations coming, and then there's more blood going to the legs and arms, you're going to have sweaty, cramps, pins and needles, things like that. And if there's no blood in your head, all the blood is going to the legs, you feel lightheaded, you collapse. That's why people faint when they are stressed out. You collapse and then you faint and you start having dizziness. You can't be explained. People end up taking all sorts of tablets and all sorts of investigations. They are negative. It's always good to go and see the doctor. They rule out other physical causes of the dizziness and all these symptoms. And then also the same thing about your sleep gets affected because you're going to start worrying about whatever is going on in your life. So that becomes anxiety. Those are the symptoms of anxiety. That's how they come up. I think you all understood how you get this anxiety. So those are the symptoms. There are lots of other symptoms of anxiety. Plenty of symptoms we have of anxiety and worry. Sometimes anxiety can be episodic, and sometimes it can be continuous. And it can also be to a situation depending on what you've been exposed to. Sometimes you've been exposed to traumatic event, rape, harassment at work, since we're talking about issues at work, the accidents at work, things like that. They can actually cause you to start worrying too much, what you call post-traumatic stress disorder. It's all part of anxiety, the anxiety symptoms there. So anxiety has got a lot of different manifestations, but basically the symptoms are almost the same to do with. Once you start thinking about anxiety, just think of the situation of the snake or the lion, or when you're angry, how you think and feel when you're angry. Same thing as well. Those symptoms are exactly the same symptoms you get when you've got anxiety. There's a very interesting program called Friendship Bench. I don't know if you've heard of it. It's in Harare. It's led by these grandmothers, and they are working in the city council clinics. Because certainly our medical staff, they are overwhelmed with work. They tend to focus more on the physical problems, and also the physical problems are well funded. So you find nurses, they also prefer to do the work which is properly funded and which has got clear-cut programs. But mental health, because the funding is very poor, and also there's very little for people to benefit there. So introducing the friendship bench concept, at least for Bulawayo City, I've always been asking Prof. Chibanda why he introduced it in Harare and is pushing Guero. Now he's reached as far as Guero. He's not coming to Bulawayo. I'm asking, why are you not coming to Bulawayo? I'm here, I can assist people if we need to do the training for these grandmothers, because they are grandmothers who are going to be looking after people. But also, his project, it may not be the best, because grandmothers, they are good at talking to the women. He is actually complaining that his patients are mostly the women. The youth, they don't come. They don't want to be seen sitting on that bench talking about their stressors. So now they set up what is called the Youth Friendship Bench. It's still being evaluated. So I hope something is going to come up. They've done some work at Pindura University. I hope they'll come to NAST. I keep asking him to come to NAST and also do something for us, this side of the country. And also the men, I was asking the other time we met at a workshop for the mental health at the workplace. I was asking, why can't we have this kind of friendship bench concept where there are peer counselors among people who are working? Because people at work, I think they understand each other. They understand the problems as well. And even sometimes people, when they finish work, they say how to solve their stressors at work. You've made a mess up at work. Instead of talking to someone else, the people always say, let's go and have a drink and forget about this. So obviously it's a big problem. But if something can be done along those lines, that we actually have peer counselors among the people who are working, just like those grandmothers. We have some people in the workplace who are actually going to be pushing this. I think it will do very well. I think I really want to go with that idea of having a mental health policy. Mental health policy, unfortunately for government, it was developed in 1984. As a mental health policy, which we are, and so in 1984, then revised 1999. So 1999 version is what we are still using. Obviously, things have changed, almost 20 years there. Things have changed. The strategic plan was put in place. As he said, it's not being publicized. We went there for the launch. It was just a small little occasion, and then they said, this is the plan. But very ambitious, but no funding. So funding becomes a big problem again. So they are really appealing to corporates to really start getting involved. And as you also rightly said, this idea of having a mental health policy, you can have a SHE policy, you can have a HIV/AIDS policy in companies, even in terms of treatments. Are there incentives for people to come out if they have got mental health problems, if they are incentivized? If you have got HIV, you're incentivized that you go get ARV from the company, you're going to get all sorts of help from the company. But with mental problems, you actually at risk that if you come out, you are risking that you may actually be dismissed. That's a big risk. So people actually don't usually come out if they've got mental health challenges. Be there depression, be there substance use problems, or even the serious ones, you'd rather hide it. Even getting a sick note from a psychiatrist, taking it to your workplace. People actually refuse my sick notes. They'd rather get the sick note from their GP. So now I have two stamps. One stamp for the sick notes and one stamp for everything else. Because I realize people are actually in trouble with their employers. Once you start visiting psychiatrists, then they are already being stigmatized. So we should stop all those kind of practices in the workplace and start embracing that anybody can actually develop a mental problem at any level in the organization. And most mental health problems can actually be cured. They can be assisted. If help comes in early, people can actually get help early and then people get better. But we find nothing much is being done. Even medical insurance, medical aid. You know, medical aid does not cover for people who are using substances. If you are using substances, doctor writes substance-induced psychosis, substance-related depression, suicide. Medical aid doesn't cover those things. So there are policies which need to be changed as well. So it's not just only to do with employers, but also the health funders. They should change the way they treat. Most people, now nobody wants to come out and say I've got depression because nobody's going to help them. Even if you've got a big medical aid which is going to be helping you, but you're not going to access it because you've got depression. Medical aid is not going to be paying for people who are using substances or are suicidal. People actually shy away from seeing psychiatrists. If you find my office, initially I used to operate in the front. I realized that people don't like coming, they prefer to come to the back. They're very comfortable, so people don't really want to be associated with the psychiatrist. It's quite a big problem. I think the issue of stigma is a big problem among our population because people don't really tend to accept psychiatrists as people actually there to assist people with mental health problems. People, they'd rather talk to their GP because once it's psychiatry, then it's in Guchene, then there's a big problem. But sometimes it's just depression, which is actually the commonest condition in the world, and people are actually running away from it as well. People are still not comfortable. So people are very, very uncomfortable visiting psychiatrists. And also, in terms of treatments, sometimes there are talk therapies. Sometimes you do talk therapies with people like this counseling and things, clinical psychologists. People may be comfortable. But once you want to introduce medications, then people are also not comfortable with these medications. What they are saying, the medications sometimes they make them too sleepy, they zombify them, they can't function. Again, they become more problems again because of all those challenges. And also this issue of beliefs. What do people really think is their cause of their challenges? You may actually have symptoms which may be physical, but actually be caused by a mental health problem. But people may not know that their physical symptoms are because of the stresses they are going through, whatever is happening in their lives. So instead of people trying to marry the two, people are always trying to rather have the physical aspect being promoted and the mental health aspect, once you start introducing it, people are not comfortable. Because they always tell you, I don't have stress, I'm not stressed out, but I was also talking about positive stress, isn't it? You get married, you're starting a new family, there are obviously stressors there. You deliver a baby, you have what is called postnatal depression. Nothing to do with you really getting stressed, but it's just more to do with the hormonal changes causing you to have this kind of problems. Even simple periods, people are having periods, they can actually have mental health challenges related to that. So in the end, they cannot function at work, they can function at school. But people don't want to associate it with the mental health problems. They always think that it's a physical problem. Let me get a physical solution to it. Once you start talking about the mental health issues, then people are not comfortable. I think we really need to work towards everybody must be involved, from the top management to the bottom people. Everybody must have mental health awareness, but it doesn't affect any particular group. And also this issue of having a mental health policies in place, I think is something which we can easily be done if we manage to do it with HIV, AIDS, with all these natural HIV policies in different workplaces, SHIP policies. We can also have a similar mental health policy in all workplaces, and then we start actually working on it. And also, if we can even accredit companies which are actually doing a mental health program in their workplaces, like Congo, yeah, I'm very impressed with the work they are doing. I think if there was an accrediting body which would actually say they are ISO certified for having a very good mental health program, so you get so many points and you get whatever advantages which comes with being accredited for that, I think it would really go a long way in trying to control this issue of stigma towards mental health issues. And then maybe when there's more open discussion, you don't want to have this kind of problem we're having at the moment.